Four years ago, my father had his first heart attack. He was playing tennis at Loma Linda. He drove all the way to Palm Springs with crushing chest pain, went home, decided he was going to crawl into bed, and ends up in the emergency room in Palm Springs and actually ends up having a complete occlusion of one of his vessels, and they were able to open it, put a stent in it, and, save my father's life. At that time, I realized that, we're all genetically linked to somebody, and I happen to be linked to him. His cholesterol makeup looks identical to my cholesterol makeup. And so the question is, what could I do to prevent that from happening to me? The urgency increased dramatically in the last several years because my father now has early dementia.
Being born in 1955, I sit smack dab in the middle of the baby boomers, and I'm not very excited about aging, and also want to, maintain my health and physical activity as I get older. Really realize that there really aren't many places out there that are doing not only complete examinations, but also really helping you develop a plan for the rest of your life.
I decided that it would be a good time to think of opening some type of center that we could help people who want to prevent long-term illnesses, heart disease, and dementia.
Well, the Mission Center for Longevity is a place where people can come and get a comprehensive assessment of their health. And not only that, we give them follow-up where we tell them how to correct the areas they may be deficient or lower their risk for certain diseases. And we follow them along and try to make their health better and make them live longer and live well.
Executive physicals have been around for more than 25 years, so there's nothing really unique about the executive physical. So when we developed this, we really tried to look at what was already going on and tried to develop something new and exciting. So a few of the things that we put together were some of the new and unique technologically advanced diagnostic tests for health and wellness. One being the exercise treadmill utilizing the VO2 Max technology, one of them being peripheral testing for vascular disease, digital mole mapping technology, which really takes a picture of the entire surface of your body and is helpful in identifying precancerous lesions, as well as gives you a benchmark for a year from now when you look at that mole on your back and say, is that getting bigger or is that just my imagination? You can actually come back in and we can actually make the comparison for you. The other thing that's a little bit different about what we're doing is that once we put your personal wellness profile together, which really takes a look at your family history, what do you have going on in your family already, what kind of a lifestyle do you live, we combine that with the results of the physical exam and then create a plan. The final thing that's unique to us is that rather than at the end of all this sending you a binder in the mail and saying, here you go, good luck, have fun with this, hope you feel better. We actually have you come back in and do a follow-up consultation with the physician so that you can really sit down and take a look at what your risks are, take a look at what some of your markers are, and make a real plan for health in the future.
This is a center which, for those patients who are inclined, that means they have an ear for listening to the details that are going to give them the key answers to their health concerns in a way which they can then implement. And then we can monitor in a lifetime manner. So if somebody's 45, 45, and they have a slight thickness of 1.1, let's say in the carotid intermedial thickness, if we monitor that in a year later, after aggressive personal lifestyle changes, perhaps conferring with their own primary care doctor, we can then monitor the regression of that. So it gives someone an opportunity to be at a clinical site where they can really go for the real answers that are going to help them for long-term longevity and wellness.
The real question comes down to is, why can't I go to my own physician and have this same test? And the answer to that is, You can have similar testing as this. It's just going to take a long time to get it done. Most physicians base their exams on a time system because they're reimbursed from insurance. So when do you ever get to sit down with your doctor for an hour to an hour and a half at one time, and who looks at all your aspects? We're not just saying your treadmill, and we're going to address that. We're going to address your hearing. We're going to address your moles. We're going to address your cholesterol. We're going to look at your treadmill. We actually look at VO2 max, which is a really good cardiopulmonary assessment, and then give you a package that says this is your health, this is your health age, and these are the things that you need to work on to improve your health.
We're concerned with prevention here. Detection of disease is important, but more importantly is to prevent disease. Once it's already happened, we're just repairing things. It's far better to keep the patients healthy up front. And so we go into all the health practices that will keep them healthy.
When you come back a year later and redo the exam, we can look at improvements or where you haven't improved and what can we do to help you achieve those goals.
It's a different model than these are the screenings, nothing came up, see you next year. It's a very different model for healthcare.
But it really boils down to relationships. And when I say relationships, I mean our relationship with Mission Hospital. We're affiliated with them. We'll be doing all of our testing with them. They've agreed to get our patients in a timely manner. If they need to have scans, they're not available under our roof here. That's a relationship. It's about relationships with different corporations in the area, talking to them about what we're able to do, and about relationships just in general with our patients that walk in the door.
Well, you know, the relationship that's been established with the Center of Longevity is comparable to all of our centers of excellence here at Mission Hospital. It's really an extraordinary, innovative center that is linked to one of the most comprehensive, technologically and diagnostically advanced medical centers in the country.
Our community hasn't had a wellness center like this. People have gone up to Sentinella or down to Scripps to get their full executive physical. And we have outstanding doctors and technology here in Mission Viejo. There's no reason for them to leave the town. And so we hope that this center will be the center of excellence that the Scripps and Sentinel compare themselves to.
So if you really can get an evidence-based, personalized approach to looking at all your health issues and using real high-tech diagnostic tests, you will feel better. Your perceived sense of health and wellness is something that's very invaluable to someone who is the head of their family. Maybe they're the major breadwinner. Maybe they're part of a local book club. But we all want to feel like we have some value to society, and we can only provide support for them feeling that they're going to be around for the long haul.
I'm actually a patient. I've actually been assessed by the center, and it was an extraordinary experience for me as a patient. Provide me with a charge in terms of taking responsibility for myself and give me a map to making sure that I can be as independent as I possibly can be for as long as I can be. And that's important because I want to be healthy. I have 4 young children and I want to be here for a long time. So it's really a testimony, I guess, to saying the reason why we partnered and I invest in this center as a center of excellence for our medical center is because it does work. It makes an impact on one's health and can truly, and is aligned with one of the best medical centers in the country.
We develop a relationship that's a partnership where together we can work on changing things.
Taking a snapshot of where your health is today in combination with your family history, and then together putting those two things together and creating a plan that can take you through the rest of your life, minimizing your risk for cancer, heart disease, and stroke.
But we hope this is an adjunct to their regular medical care, and I really hope that it makes a difference in people's lives and helps them live longer and healthier.
If someone came up to me and said, Charlene, you know, what I found out as a result of this physical exam saved my life, that's all I need to hear.
Thanks.